going to pass things over to our wonderful moderator, Aarati Cohly, who is the Chief of Staff at the Mayor's Office of Engagement and is an amazing colleague, and really excited for her to moderate today's event. Thank you, everyone.
Amazing. Hi, everyone. I'm so excited to be in a virtual space with you and in community. And I'm really excited about this conversation. We have an amazing panel of women who are leaders in this space. Councilmember Narcisse, Reverend Sharon White-Harrigan, Brianna Cea, who represent also women in different parts of the civic engagement space. And just to set up the conversation, we're going to have like a structured Q&A for the first part. And if you have questions, please feel free to put them in the chat, and then we'll do our best to answer them in the last 10 to 15 minutes of the panel. But today, as Lea kind of teed us up, we are talking about community care and the intersection with civic engagement. From my lens, and as a woman and as a child of immigrants, I think there's just such a clear correlation between the two. And I don't think it's possible to have engagement that's meaningful if you don't care for yourself and for your community. But sometimes that doesn't always show up in our work, unfortunately. So I'm very excited to really dive in today to talk about why it is critical, why it's important, and different tactics and tools we can use as a community of women for Women's History Month. It's very timely to ensure that we're engaging New Yorkers thoughtfully, and also ensuring that we're taking care of ourselves so we can continue this great work. So I'm actually, the first question I want to ask is, you know, from your perspective, and we're going to start with Councilmember Narcisse, if that's okay. What does it mean to care for yourself, and why is community care such an important tactic that should be used when we're thinking about civic engagement?
Thank you for having me, and thank you for putting this panel together and all the great, powerful women in place. I want to say happy Women History, because History Month, what it means to us, it should be every day, 24 hours a day, 365 days a year, because we keep the world moving. For me, I do find personal comfort in caring for others. That is probably why I became a nurse and functioned as a nurse, once a nurse, always a nurse, for the past 30 years. And I think that also is contributing for me to be effective in the space where I am today, and allow me to be a passionate council member. However, we all need to focus on our mental health. It is a must, particularly following the unprecedented last few years. COVID hit us so hard. If we have learned anything, it's for us to take care of ourselves. Because if you don't take care of yourself and you're not in a good space with yourself, and you have your mental capacity is not there, then you cannot help others. So that's what I think about.
Thank you so much, Councilmember Narcisse. And I think something you brought to light is a lot of people in this space come from the medical profession, nurses or social work, and how it's so intrinsic in the way that we do engagement and show up as people in this space. So I'm really glad you highlighted that. Before I pass the mic, Councilmember Lewis is on Zoom. So I want to first give her an opportunity to give some remarks, and then we'll continue with the panel.
Thank you so much for hosting tonight. Thank you for moderating this evening. I won't take up too much time. I'm Councilmember Farah Lewis. I represent the 45th Council District and a proud member of a majority-led Women's Council. I'm also the co-chair of the Women's Caucus. I'll yield back to you.
Amazing. We are so happy to have you here, and we're so grateful for this partnership. And it's just amazing to be in a city where there are women who are leading the way. So thank you so much for being here. Really appreciative. So I'm going to go to the Reverend, Reverend Sharon. Something we talked about when we met as a group was, a lot of times we talk about care and the importance of care, but we don't always practice care. So I'm wondering from your perspective, how do you ensure that in the spaces you're in, you're practicing care and you're encouraging others to do the same? And how does that look in your space?
Thank you so much. And I want to say thank you. It's an honor and a privilege to be here with everyone, especially just, women and gender nonconforming folks and everyone in this space. Thank you for having me. I think it's important that we first even understand what does it mean to care for ourselves, right? And we say it a lot, we have these buzzwords that self-care, but what does that really mean? And so what we do, it starts at home, right? And how do we practice that? I incorporated in my agency, WCJA, the Women's Community Justice Association, by, making sure my staff works maybe 4 days out of the week, but get paid for the full 5, by, making sure that, we take off when holidays come, from Christmas to New Year's, maybe a week after that, so no one is having to carry somebody else's work. And just really understanding what does it mean. It's not the superficial getting your nails done, getting your hair done. That's maintenance, right? We as women, people, folks, nurturers, we have this thing about urgent care and aftercare, but not self-care. It is always when something happens or a need or an issue or a challenge arise that we go into action and then talk about how we need to take care of ourselves. So, by educating and teaching and showing people how it is okay to say, I'm taking a mental health day, right? I am exhausted, I'm tired, like I feel like my mind is boggled, so I'm not gonna go nowhere today. So it's really just not only holding yourself accountable, but holding other people accountable and say, hey, you know what? You don't have to do today, and it's all right. Don't feel bad about it, because the work is going to continue whether you hear or not. And that's what we need to understand. If we die today or tomorrow, God forbid, people might miss you, might shed a tear, but they're going to replace you because the work got to continue.
Thank you so much for sharing that, Reverend Sharon. And I think something you hit on that's really important is reactive versus proactive care. And how do you ensure that you're caring for yourself before it comes to a situation where you really need to handle an emergency? And with that, I kind of want to ask Bree, something, I know from your personal experience, you can really touch on this, but also something I've heard you speak about is avoiding burnout, especially when thinking about engaging young people in a space where a lot of times you can feel disillusioned and not want to engage. So why is proactive care so important from your personal experience, but also from the perspective of avoiding burnout?
Yes. Hey, everyone. Thanks again for having me. Also very honored to be on this panel. And yes, that really resonated with me, and happy to share from my own personal experience. For those of you who don't know me, my name is Bree, and I'm the founder and executive director of an organization called Generation Vote. We are an intersectional youth-led movement that is fighting for our right to vote and a just democracy for all in New York and across the country. And so I think my personal experience speaks to the work I do in the Generation Vote and civic space. So exactly to your point, as someone who works with young people fighting for our right to vote, I work in a space that is not the sexiest of topics for young folks, right? Consistently, when you ask young people what are their top 3 issues that they're fighting for, that they care about before re-election, voting rights and democracy usually doesn't make the top 5 issues. And that may be the case for many of you on this call, right? And so I work in a space where young folks constantly feel like we are up against this wall where we're trying to get our peers and our friends to care about this fundamental issue of voting rights and democracy and civic engagement, and trying to convince our friends and our peers that this is important. Because if you care about voting rights, I mean, if you care about any other issue like abortion or about climate justice, you need to care about this fundamental issue. But many times the young people I work with, they're like, Bree, we feel like we're hitting a wall because our peers, this is not a popular issue. And so often this can lead to burnout. This can lead to folks feeling like they're just shouting into the void. And so a Generation Vote, we're trying to change the vision, the story, and the culture around what does it mean for young people to organize around civic engagement and voting rights in a way that, one, feels urgent, but not so urgent to the point where we're burning out our organizers like you see too often in the political space. And so definitely happy to later in the panel talk about some of the practices that we use at Generation Vote within our organization and community to ensure that our organizers are not feeling burnt out, where they feel like they have to, leave a campaign after every cycle. But in terms of my own personal experience, the reactive stuff we just talked about is super relatable. For some may know this on the call, I just underwent hip surgery 4 weeks ago. This is actually the first event that I'm doing from a chair. I've been lying bedside the past few weeks, so super excited about that personal win. And you might be wondering, Bree, how old are you? You're like 20, I'm 25. How did you get hip surgery so early? And honestly, the true story is I got hip surgery because I wasn't being proactive about self-care. This is a situation in which I was a typical organizer, putting my own physical health on the back burner last year, where I got injured in July after doing a practice of self-care. I do Muay Thai, and I got injured and I didn't take it seriously because it was the summer before the midterm election. And I knew that I had to be out in Arizona and out in Nevada and out in New York City knocking on doors. And so I just kept putting it off. I kept putting it off until finally to the point where I was knocking on these doors, and every day when I came home in October, my back hurt, my hip was swollen. And I knew that I was pushing myself to the point where I was being a hypocrite. I tell my organizers to take care of themselves, to take those mental and physical days, and yet I was putting the work before my own body. And it came to a point when I came back home to New York City, my doctors were like, Bree, you have a torn hip, you got to get hip surgery. If you want to keep living an active lifestyle of knocking on doors and doing the self-care practices like Muay Thai that keep you mentally sane in this space. And so that really put things in perspective for me, where I was like, wow, I pushed myself to the point where I made a sacrifice that I think too often I tell organizers, you shouldn't be put in a place where you feel like you have to put your body on the line, but I did. And I think the biggest lesson for me is remembering conversations like today, how do we create those boundaries for ourselves within our organizations and our own personal lives to ensure we don't push ourselves to that point, because you don't want to deal with the ramifications of all the health bills and also being put on the sidelines for months because you could have prevented this in the first place. So that's my own kind of, when you all talk about before being reactive, I was like, that hit super home, and happy to talk more about that experience.
Bree, thank you so much for sharing your story. And something that you talked about, and Reverend Sharon, I think also really put to home is like creating a culture of care, right? And so, yes, it's important to take care of ourselves and create those boundaries and ensure that we are showing up in our best selves because we're taking care of ourselves, but also being in spaces and when we're in positions of power, cultivating spaces where care is prioritized. So Councilmember Narcisse, I know this is something also you're passionate about, and I'm just curious from your perspective, as a councilwoman, how do you ensure that your staff are in a space where they're cultivating care? And then broadly, even in the city council, how do you feel like care shows up, and what do you see your role and in that space, I guess?
Honestly, for my staff, and it's a conversation. As a nurse that I hold dear to my heart, I always reminding folks, how you feeling? Is your work is okay? How you feeling today? How's the family? You engage people in the conversation. And for me, I still maintain, let's exercise. Did you exercise today? When you exercise, what do you do? Even my colleagues, I have the conversation the other day that made some of my colleagues uncomfortable because I told them, I started going around, oh, you have a primary care physician? Do you have somebody you can talk to? They all look at me like I had 4 eyes at first. And then when I started to say, relax, I'm the nurse here. So we need to have a conversation. And if you're of age, I'm not gonna ask you the age today, but did you have your colonoscopy done? When was the last time? And I said, guys, listen, if I'm a nurse here talking to all of you and we cannot have that conversation, that's mean I'm not a nurse. So once a nurse, always a nurse. Let's have the conversation. So I make it like in a way, try to find a way that where people can make comfort, and the same way I do it with my staff. Nobody can tell me if you want to go to the doctor or you want to relax, you want to take the time off, or you need a break, you need a breather. I will say no to you. This is something that we have to talk about our health, like we're talking about going to an event, like we're going to see a friend. It should be a normal thing. Like mental health should not be something we're uncomfortable. We have to talk about it. If we don't talk about it, then it's comfortable. But if I'm sitting there, I say, oh God, I'm so stressed. I need somebody to talk to. Where's somebody I can talk to? Let me call my psychology. So therefore, you know that it's something that we can bring to the table. It should not be like embarrassed to talk about it. Once they see the medical professional start talking openly about it and engage the conversation, then it would be easier. For me, my life, what I try to do is trying to make people comfortable around me. And even the conversation that should be kind of difficult for others, I'm kind of laughing about it. I just talk about my own family, my own experience. And that's the step that I've been taking with my friends, my colleagues, and my staff in their office. My office is a friendly, atmosphere because I'm always smiling and laughing because that's my nature. So what do you want to talk about today? I see you're looking so far away. What's the problem? And you want to come and talk about it? By the way, I have a couch in my office so people can come and hang out. Sit down. Let's have a little coffee. Did you eat? When was the last time you eat? You have because we human. We not machine. We have problems. And the problem you're facing today, you're not alone. Somebody else, because my grandmother used to say that if you listen to somebody else's problem, then you realize that you don't have any problem. So that's why I'm blessed to be alive. I just came from the funeral, 53 years old, passed unfortunately with some complex things that we're talking about, but since family not talking about what's the problem, so I'm not gonna put it out there, but it is a problem that we face in our community when we have mental health. And we hiding it, we don't want to talk about it, and we turn to drug, other comfort things for you at the time of the difficult or the challenges. So more we open, more we talk about things, I think the easier it gets for all of us. Yeah.
I love that. And I feel like you spoke to like destigmatizing mental health and physical health, making it a part of the conversation, and genuinely taking time to say, how are you doing as a person? That is like an easy thing that everyone should try to integrate into the work culture, and having a space where you can have those tough conversations, because they do impact our work. And when you can create space, that is also how I think we can avoid the burnout, how we can avoid the challenges that can lead. Something that I think you both spoke to, Councilmember Narcisse and Bree, is how engagement, and when you're in this space, it can become your whole identity, that you forget to take care of yourself. You forget to make time to go to the doctor. You put it on the back burner because you think you prioritize other things, and it can be really hard because sometimes it's so tied to your identity. We all love the work we do. We care about the people we serve, but in a way, it's a disservice when we don't care for ourselves, because then we can't show up as our best selves. One thing that I think is really clear and that we've touched on is just the clear integration between community engagement and personal and community care. But something we talked about in conversation that I think is really important to uplift is a lot of times, and something that's come up a lot in conversation today, is people are tired. They do not want to engage because it feels like an extra burden, or something that they just have to do in addition to living their daily lives. And I think that was exacerbated by the pandemic. So I'm wondering, and this is something I think Reverend Sharon, you can speak to, is how can we uniquely engage with community in a way that it doesn't feel like a burden and it feels enjoyable and people want to engage, and whether it's using tactics and tools like storytelling or even just having more conversations like this based on your experience. I'd love to hear, like, what are some of those tools and tactics, and why is it so important to think creatively when we're thinking about community engagement?
Important because, you know, that's something, especially for women, that it always just seems like it was a fight to be a part of, right? To stand in front of. And let's make it very clear, from from civic engagement to courtroom environments, trauma law, trauma in politics, trauma and a lot of things just never meet, right? It's never incorporated. It's not, nor is healing. And it's important now, we make it unique because we add this healing component, right? So, because you can't talk about trauma, or we shouldn't, without adding that healing component. So even in storytelling, as a formerly incarcerated woman who's also a leader, who's also a social worker and a professor and run an agency, it is important that we know how to weave these things together. I think that what we find is, we ask people to tell their story. I've been there. When I came home after doing over a decade in prison, it's like, oh, tell your story. And people get wrapped up in the story. But it's, we get caught up in the trauma rather than the healing, right? And so storytelling should be in a way where it's told, where it connects how these issues, things that one go through, right? And connected to policy, connected to voting, connected to all of these things in a way that, it's not more traumatizing or re-traumatizing for someone who's telling the story, but yet it's empowering, because what I went through, I don't want somebody else to go through. So now we done connected the dots to where we can push this forward. And in that, there's healing in that in itself. So, you find unique ways. I tell, we have a whole task force under WCJA. And I tell every woman who speak for us, who speak for anybody else, you don't have to be the character in your book anymore. You're the author. Just be the author. Learn how we must step outside of ourselves, right? And look at, how does this no longer traumatize me? How do I not keep living through this story, although it's my truth? And how can it help others, but yet I'm caring for my mental health, my heart, right? And how do we connect it? So those unique ways is, how do you take everything that we are doing and adding a healing component to it, right? Because I mean, the reality is, you're gonna, when you keep doing the same thing over and over and expect different results, we know that's the definition of insanity. So we have to find different ways, change the trajectory of how we do things, what we do things, and that's it's less of a burden, not only on people, their heart, but their mental health.
Thank you so much, Reverend Sharon. That was beautiful. I could just listen to you communicate and storytell, honestly. And I think something you brought up that's really important is that you never want engagement to feel transactional or exploitive, and that you are taking things from people and you're asking them to share, and there's no two-way street or feeling of community, right? Where it feels like you're extracting things and there's nothing that feels collaborative or, storytelling is very effective when it is done authentically. And when it's not, you can tell and you can feel it. And that's something we talk a lot about in the spaces I'm in, is that in a good community engagement event, you can feel it. It's like sometimes not something very like strictly that you can articulate. It's not always tangible, but it's like a sense of feeling. And you can tell right away when you're in a safe that you feel you're in a space where you feel safe and you feel like you can authentically share, versus a space where it's storytelling for the sake of storytelling, or very much, to promote something or whatever it might be. So I really appreciate you articulating it. And I think understanding what are spaces that you want to be in and feel safe is a part of self-care as well, right? Going into spaces where you understand the intention, the purpose, and you can authentically share your story, and use it as a tool to empower people, but not feel like it's transactional. Something that I kind of want to hear from Bree about is, when we're thinking about engaging with young people specifically, because a lot of times I think young people are very quick to kind of sense when, hey, this feels transactional versus this is a space where I want to be in and where I feel is authentic. And they are, in my experience, will tell you straight, which I appreciate. But how in your work do you, think creatively about engaging young people, but also think really intentionally to ensure that it's not transactional and that you're really thinking collaboratively with young people to ensure that the programming resonates, but it's also not exploitive in any nature?
Yeah, thank you for that question. And also similarly, Reverend, I can hear you talk all day. That was incredible. And I think and I hope this touches on the question you just shared, but I think what you were discussing just reminded me that what drew me to the work of civic engagement, right? For me, people ask me all the time as a young person, again, civic engagement, you don't see many young Asian women leading voting organizations, period, in this space. And as a result, arguably, a lot of the democracy and voting spaces that young people, which is an increasingly more diverse ethnically and gender-wise, all definitions of the word diverse, when they enter the space that I'm in, it doesn't usually reflect my generation. And as a result, it leads often, I think, to feelings of being exploitative or transactional, especially in the democracy and voting space. So I think that definitely matters. But people ask me, what brought you into this space as a young person that cares about voting rights? And this is what you dedicated your, short career to. It's because for me, civic engagement ultimately comes down to caring. To me, civic engagement and voting is making sure that people feel like their voices matter and that they're being heard, right? Too often young folks, when they come to me, and studies will show this, young people, they understand that our democracy is broken. Right? Consistently, young people Generation Z is saying, we understand that our democracy is broken, but we have hope. We have hope that it can change, and we will continue to fight, and we'll continue to fight and care about the issues that we care about, whether, again, be climate justice, racial justice, democracy, because we have hope in the future. But too often, when they, are engaging in conversations around civic engagement and democracy, there aren't folks in the space or in the room that make them feel like their voices are being heard. Or if they're going to go vote, it's like a one-way street, right? Too often candidates won. If they even engage with young folks, which too often they don't. But if they do, it's kind of like they show up every 4 years. And then they're or 2 years, right? And then they're gone. And so when it comes to authentic engagement with young people in the civic engagement space, I think it comes down to a few things. One, if you're a community organization or if you're a candidate or elected official, have year-round discussions with young people. Really listen and hold roundtables to understand what matters to them and how can your office work with them to not only partner and show up, but also uplift, right? Have youth representation in your staff or in your advisory councils, whatever it is, or in your organizations, pay young people to do the work, is one recommendation I have. And the second recommendation I have too is look around the room and see if you're in a space that is about an issue that matters for young people, which is arguably every space because we're the future. We are the now and the future. Make sure there's young people represented in the room. Too often I show up again in my space in the democracy and voting world, and I'm always one of the youngest people, right? Shouting into the voice to why certain voting policies matter for young people and for people of color. And so I definitely think if you are in these spaces, look around, see how you can bring in young people, not just in a cyclical nature, but every time you can. And that in itself can lead to folks feeling like you're not exploiting their vote and that you're actually authentically engaging and listening to their voices.
Thank you so much, Bree. And I agree, like integrating it into the practice so that it's not something that, again, is reactive, but is really built into the way that the work is done and the culture. I know that Councilmember Lewis is still here, I believe, and I just want to ensure that before she leaves, we pass the mic to her as well, as someone who's also been in the healthcare field and as someone who, you know, really does believe in civic engagement. If you have a few minutes before you have to hop, I would love to give you the opportunity to quickly just share how community care really shows up in your work and the intersection between community care and engagement.
Well, thank you. I want to thank you for the opportunity to speak. I think it's been highlighted through the Reverend, through Bree, and through Councilmember Narcisse. One thing that I'll share, because I think that they've eloquently have put it all together already. I think part of this conversation that I haven't heard yet is we are sharing our shared experiences, but we often don't speak about access to self-care. I think what we were able to do in the city council as a council member, co-chair of the Women's Caucus, is create these packages like the Black Maternal Health Package, the Survivors Package. We often see women or women identified people who don't have access to the care that they need. So they get so boggled up with their work and so focused on their work, they don't think about the pain. Like Bree spoke about her being out in the field and doing the work, and she forgot about herself. She forgot about her pain. She forgot about how she felt. But what I often hear is folks don't have access to that care. Councilmember Narcisse spoke about mental health. We often hear this conversation, and more so during the pandemic, is you often don't have access to a therapist that understands you, or a culturally competent therapist or a psychiatrist that can understand your needs. So then what you end up doing is you get distracted in your work and you don't take care of yourself. So I think being civically engaged is a great thing, but the intersectionality between civically engaged and taking care of self is making sure that you're also showing people you could be civically engaged and a productive member of society and be healthy at the same time. You can do all, but I think the focus that we need to work on through the city council and through the state is making sure that there's access to care, getting the right providers that understand your needs, and making sure that they're also checking up on you. And I want to thank you for mentioning this earlier about the workplace and making sure that we're making spaces for our staff, volunteers, interns. Sometimes our staff don't know to take care of themselves. They don't know when they're burning out. And what ends up happening is that chaos may be created at home, or maybe in the community, or maybe in the office. So it's important that we're checking in, like Councilwoman Narcisse does to her own colleagues, and shares with them, hey, take some time for yourself. Did you eat something? You know, do you have a PCP? Because these questions are important. Sometimes they're uncomfortable, but the fact that somebody asks, that means that they care. So I think we should all take a page out of her book and Bree's book by taking care of herself and understanding that it's great for us to be civically engaged, but the best care is self-care, and people will tack onto that. Thank you.
That was amazing, Councilmember Lewis. Thank you so much. And there's some love coming to you in the chat. I think something you highlighted that's really, really crucial, and I do want to talk about this, is access, right? Because we can talk about care, but the truth is we don't live in an equitable society, and not everyone has the same access to resources. And also, like something we talked about early on, is stigma. In some communities, mental health care, self-care is stigmatized, and it's not something that is openly spoken about. So how, as leaders in the space, and I loved also how you stressed, you can be successful, you can be a successful public servant and also take care of yourself. And I think we live in a society that also glorifies working nonstop and frankly, sometimes leading to burnout. And I think a form of resistance is taking care of yourself. It's against what is, you know, normally taught as the status quo, the American dream, the child of immigrants, working hard, that's how you will succeed. So I'm just curious, and I'd love to start with Councilmember Narcisse, then go to Reverend Sharon, and then Bree. But how do we ensure that in our work we're actively thinking about these challenges and barriers to self-care that are really present, whether it's access or stigma, and how do we go beyond the conversation and actually take action? And I think you've all stressed this in different ways in what you've already said, whether it's implementing it in your work culture or even just starting the conversation. But just to Councilmember Lewis's point, I really do want to emphasize that. And I would love to hear from each of you just, how do we address those barriers, and how do we really distinctly take action to ensure that we are creating a culture of care? So I'll start with Councilmember Narcisse.
Thank you. And as the council member Farah Lewis just mentioned, is the create access to address inequities in your community. We know that, yes, it sounds great that we want them to take care of ourselves, but if we're not creating access where we are, then we will always feel like kind of meeting that bumps. Like, I want to do this, but you're going to have a stop because you don't have anywhere to go. You don't have the conversation. And one of the things that I keep on doing all the time, sometimes it's so people tell me that, oh, is that the nurse talking or the council member? It's just, I say both, because I need to have that conversation. I go to church. When I go to church, because like we just say, it's a stigma. It is something that people don't want to talk about. It's taboo. It's in our culture, especially the Haitian community and the Caribbean community. They don't want to talk about mental health. And what I do all the time is going to the churches and talk about it. If I'm having a conversation, whenever they give me a chance to talk, I ask about mental health. Do you know it's just like the physical health? Like, you have diabetes, you can try to get treatment, you have hypertension, but you know that mental health is something that we need to address. We can pray, but we still have to see the doctor. And I will make that conversation all the time. I'm intentional about it, talking about mental health, talking about getting access, talking about that prayer is not gonna just change everything. Yes, you need prayer, but you need to go to the doctor. And one of the things that I do a lot, I do like health fair. I do it inside the church. I do it in my office. I talk about food. I talk about exercise. So in the park, let's do a diabetic, address the diabetic needs that we have in our community. Bring different vendors and try to make it like normal. Like, let's have that conversation. And I think that's the best way we can continue doing it. If you know a good doctor, like if you know, like I will have conversation with folks. Do you like your doctor? And then they will be like, oh yeah, oh no. Oh, if you don't like the doctor, you should explore. Do you know how to search for a doctor? So it's continuous engagement, especially mental health. It is a continuous conversation we have to keep, because like I would tell people, you have physical health, physical problem, like you used to have diabetes, you have hypertension, you have this, you can take a medication. But for mental health, if you don't go, because you need that mindset in order to function. Because if you have hypertension, you can function, you can go outside and work. But if it's mental, it will kind of, break you if you're not addressing it. Because you need to do it early. Don't wait for when it's really like something you cannot control for yourself. Like, you need to address it. It's okay to talk about mental health. It's okay to talk about the problem. Sometimes the problem that we have, it can be just like and one of the things that I realized in our culture specifically, like they will tell you, oh, that person cannot do anything. That person cannot go to school. That person is sleeping all day. If the person is sleeping all day, let's have a conversation. Maybe we can talk to that person. Maybe that person needs to have a conversation. And one of the things that I'm so happy that we're able to do in the council, knowing that we have 31 women, a lot of us are mothers and parents, we're able to have those kind of conversations, and we're able to put legislation in place. And then mental health, that people, actually could not get money. Now we're pushing so much to get money for mental health. And we want mental health all over. We want it now in school. We have to start early because those conversations, to get comfortable with them, you have to start early. Because a lot of folks now, when we come, we said, okay, what's the problem? That person cannot understand that child have a mental health. No, the parents don't want to face that because that's not in part of their culture. They feel like they're losing their child. They did something wrong, or they're feeling guilty. You don't know. You have to have the conversation all the time. I have people calling me that my child doesn't want to go to school. My child is lazy, spending all day in bed. No, the child have a problem. Let's talk about it. So the bottom line is, thank God we have 31 women, majority in the city council. We understand problem. And that's just like I'm having conversation with you. When we're doing budget and negotiation, we go back and forth and see how the best way we can use the money effectively and address it in everywhere. When we're talking about inequities, we're serious about addressing it. We're serious about putting mental health in the school building. We're serious to have mental health in every big clinics we have, the Gotham clinics, whatever we build, we're putting the physical and mental health together to create that access that you need. Because you can tell people to go, but if they don't have the place to go, guess what? They're not gonna address it. But if you're passing by every day, you coming from work, you see that clinic over there talking about mental health and having people bringing you the brochure, talking to you about it, I guarantee more likely you're gonna walk in and say, maybe I need to see that doctor. But if you've never seen it, you just come from work, you go home, and that's it, you don't see it in front of you, more likely you're not gonna address it. So that's what and then by the way, Bria, I love young people. Everybody, as a matter of fact, in my office, I have 5 staff, 3 of them is under 30. 3,
Oh,
yeah.
perfect example, everyone.
I have 23, I have 23, I have 24, 25, and I have a 30. And the 30 is my chief of staff. So that's how it is. I love, because the more I engage young folks, the more they can go out there, because now my office is full of young folks all the time, coming to volunteer, coming to have a conversation. I love young folks because I raise children of my own, and even our food giveaways, I strategically place one right by the school, by high school. So when they're coming out, so I can have all the conversation. I love having conversation with young folks. And if we want to change the future, we have to invest in them. So thank you.
That was amazing, Councilmember Narcisse. We talked about everything from like normalizing self-care, right? Making it a part of the daily conversation, to integrating young people into the workforce, to legislation and thinking about how we're allocating budget to community care. With that, I do want to pass the mic to Reverend Sharon, and pose the same question to you about how do we, recognize the barriers to access of care that exist, and really go beyond, which is, I think, something you've also brought up in conversation, talking about care to action. I also want to, before I pass the mic, and ask folks, please feel free to put questions in the chat. We have about 10 more minutes. We'll do our best to answer them. But feel free to do that while we continue the conversation. So Reverend Sharon, I pass the mic to you.
Well, thank you. I think that it's important that, first off, we already know, and those who don't know, I don't know where you've been, that in certain communities, especially the Black community and then the Brown community, that there aren't any real resources, there aren't anything, so it's something that's in the forefront every day, all day, right? Which is why we are having so many problems as a people. And then you add the pandemic. And I think that Councilmember Narcisse she said it all. I think it's just important to continue to have the conversations, but I'm going to go back to what I said, probably the question before, or maybe the one before that you have to add a unique, you got to put it in a unique type of way, because it's not a one size fit all solution, right? And that there are people that are not, that don't want to have a conversation, not even just about mental health, because I feel like everybody should have a therapist. One of the reasons why I became one, right? Because there weren't social workers in the prison. There aren't social workers. And most importantly, it's the Black and the brown community. And hear this, I'm going to say this with all the respect that I have, but you will not find anyone out of the white community go to a Black therapist. But this is what we are always, this is the access that we have to. And so we have to be culturally, right, relatable in order for this thing to work. And this is another reason why people don't want to go to therapy, because a lot of the organizations and the resources that are available, they're going to give you who they have. And it doesn't necessarily, you're not going to be able to identify with what I'm going through, because my plight, even as a Black woman, is different than a white woman. So there's some things that are similar, and then there's some differences that they are. So I think that, in many ways, we have to find, how do we bring the community, ourselves, to a place where it is comfortable, by providing more platforms as a leader. And whether you're in city council, whether you are in hospitality, you in retail, or you in non-for-profit, like if you have the ability and the capability to provide platforms for people in spaces, safe spaces for people to have these conversations. Tomorrow we have a Zoom on wellness with A.M. Forrest, right? WCJA, to talk about this same thing, right? To be able to start integrating it in every conversation, in every place. We have these healing circles in churches. I'm a reverend, my husband and the co-pastors, and I don't have a brick and mortar. Why? Because my ministry is in the street, where I have access to people, not just preaching to the choir, but really going out there and saying, hey, how are you today? How have you taken care of yourself? Whether you unhoused or you live in a penthouse, people should be able to know, and we are our sister, brother, siblings keeper. You know what I mean? So we have to find not only unique ways, but we have to have these direct conversations to say, hey, before anything else, before I check in with my staff and have a staff meeting, we're going to have a check-in. I want to know, how was your win? I don't want to hear about the work, right? Because as a leader, it's my job to create that environment, that culture. As a leader, as a person that runs an organization, I'm responsible for my staff. So I'm not going to just ask you how you're doing. I'm going to make sure that you're doing okay, right? Because it's my responsibility. When you have people that work for you, they're going to do everything they can. For the ones that really want to work, I just want to say that. They're going to do everything they can, right, to rise to the occasion, right? Because they want to satisfy you. They want to make you happy. They want you to see, I'm the first one here and the last one to go. That I'm going to go over and above. I'm going to trip over myself, because I want you to see me. And it's for us to say, I saw you, and that's why I hired you. So you already proved yourself, right? So it's up to us to be able to each one reach one, each one teach one. That's our responsibility in the community, in our workplace, in our home. How do we all practice this? And it's grabbing a hold and saying, hey, slow down. I tell my staff, go home. Get off the street. Stop organizing. It's not that deep. Tomorrow's another day. In fact, take tomorrow off, because it's okay. I'd rather have you mentally intact than to think of how much money I'm spending, you know? And that's what we need to really start doing, is providing the space, the place, the environment, the culture. And it's all of our jobs, right? It takes a village, and we need to be that village, period. So it's all of those things, everything that Councilmember Narcisse said, that Brianna said, it is all the above, that it is our duty, right, to help people care for themselves because you're caring for yourself, you know, and that's what it's about. And as leaders, most importantly, right, that's our charge. We commissioned to do that.
I love that. I want to even just take that clip and share it with colleagues, because I think you are so right. You hit on so many things. I don't want to even try to summarize everything. But I think something that I do want to uplift is like the need for culturally competent care, because if you don't relate to the people who are offering the care, it is not possible to access that care. I see Deborah is putting a lot of resources of culturally competent care that exists, and normalizing it, making it a part of the conversation. The last thing I'll say that I think really I want to uplift is, as leaders, it's our job to ensure that we are creating cultures of care, and not just saying it, but actually creating systems where it is possible to have care, right? And to take care of yourself. And sometimes that sadly doesn't always show up, but having a community like this, where I'm seeing so many women of color coming together and really being able to have conversations like this, which there isn't always space to have conversations like this, is super crucial. So I'm going to ask Bree, before we kind of pass the mic back to Lea, who's going to talk about clear actions we can take as a community to ensure that we are continuing to care for ourselves, but also know what resources and things that are happening in the space. Bree, just to close, again, like as a young person and as someone who works with young people, and based on just what Councilmember Narcisse said and Reverend Sharon shared, are there things in your space that you feel like are really important to uplift in the conversation, and really think thoughtfully when we're, engaging with young people, and as a young person yourself, why it's really important to think about dismantling these barriers, and how to continue to live in the practice of care that we're speaking about?
Yeah, thank you. And I think I want to piggyback on what the Reverend was sharing. And this is actually maybe a tip for folks that if you do have staff organizations that I think might be helpful. Increasingly so, if you are in an organization that is diverse and multiracial, I think we're talking a lot about, kind of interpersonal relationship care with our staff and asking questions and checking in, which is amazing. That's exactly what we do at Gen Vote 2 and others. But I think one thing that really personally, I think was important for me when I was working in a big democracy organization, and now as someone that runs Run, is also important for your leadership and for you to understand that your folks are showing up in your space and they are living so many different identities. And what happens in the news impacts their mental health, it impacts what's going on in their homes, especially for young people who are always on social media. We are inundated with information. In regards to the mass shooting in Nashville last night, right? Like we get that within 5 seconds, and it is traumatizing information, especially with young Black and Brown people that are seeing, brutality transmitted just like this from law enforcement within our hands. For as a young Asian person, when I was showing up to work and having to watch Asian elders beaten and killed, quite frankly, I would show up to these spaces and my bosses never really, they weren't paying attention to the news, or they didn't feel comfortable or were doing the work to be culturally competent and to understand and have conversations in a way that was anti-racist and also made me feel comfortable to share, like, I'm showing up in this space with multiple identities. And I think it's really important as leaders for us to think through in our organizations, like, how do we not only take care of our people as people, but also have those real conversations so that they know and understand that you see them, right? And that you're there to support them in all of the different ways that they show up in a space. And so that's just something I wanted to just kind of raise as a young person. I so often hear young people tell me, oh my gosh, like, I just saw that, going with ICWA, right? Like I saw what happened in the news of the Supreme Court and like Indigenous rights, and I don't know how to talk to my boss about it, but it's like really, affecting my mental health. And like, yeah, they ask me how I'm doing, but I don't feel comfortable enough because they clearly don't care about the issues that impact my community. Right. So in terms of if you're working with young people, I think one, understanding a lot of us, and everyone on this call, not just young people, all generations, we exist and show up with multiple identities, but especially with young folks, the way that we get information it really affects our mental psyche. And so we as leaders, we need to do the work to ensure that if we are going to be committed to doing, having multiracial staff and also in the social justice space, doing social justice work, that we are also ready to have those conversations within ourselves and with our people about all the different, ways that impact our staff beyond just the personal, but also just collectively the world.
Thank you so much, Bree. I want to thank everyone who is on this panel. Thank you so much for bringing your authentic selves today, for sharing your story, and for really clearly articulating how care and community care shows up in your work and what we're doing, and also where we need to do better. This was so fun for me to moderate. I feel like I learned so much just from hearing you all speak, and also just really excited to continue the conversation. I feel like we had such a meaningful conversation today, but there's so much more that can be said and done. I know we're at time, which makes me sad because I feel like we could continue again for another hour. But really quickly want to pass the mic to Lea. I also want to thank Women Creating Change and the Women's Caucus for creating the space for this event. And Lea, Rita talked about how it's Ramadan Mubarak. I want to just say thank you to everyone who's here, who's fasting and also observing, and for all of you for taking care of yourselves, hopefully, and if not, using things we talked about in this conversation to tangibly take that back and ensure that we are, responsibly taking care of ourselves and also creating space for others to do the same. So Lea, I will pass the mic to you. Thank you so much. It was a pleasure to moderate, and I'm excited to see how we continue this work beyond today's conversation.
Awesome. Thank you so much, Aarti, for doing an incredible job moderating into the whole panel. Bree, Councilmember Narcisse, Reverend Sharon, and Councilmember Lewis as well. It has been, I'm a little biased, but this is one of my favorite panels I've listened to in a while. So really grateful for this conversation. In the realm of care, I know we're over time, but for anyone who has a moment, would love if you would just put a word or two in to see how you're feeling and any reflections that you're having right now after this conversation. I'll say we'd love to do more events like this. We will be sending out a brief survey after, and would love to hear your thoughts on that. WCC is also working on a project that you'll hear more about that is focused around different care resources. And thank you to Deborah for starting to populate some in the chat. We'll be sharing out more information soon. And I also want to just plug a few other ways to get involved. In the city, Aarti is a big leader. There's a Spread the Love campaign, which is a great way to volunteer, to get back some time to help take care of your communities. We'll share a link for that afterwards. We also have a big primary coming up in June. All of the city council all of the seats are open, and if we want to keep the majority council, please don't forget to vote. And the last thing I'll mention is that participatory budgeting voting is also happening right now, which is another great way to have your voice heard and to emphasize what your priorities are of care or of any other issue in the city. You can really make an impact with that. But please take care of yourselves. Take a break, take a breath, and really appreciate you being here tonight. Thank you.